Hey everyone, it is Kevin Henry. I am the Director of Marketing for Fortune Management and glad today to be joined by one of our partners, and that is Justin Pointer with Arthur Marshall. Justin, what's going on, man?
Hey, Kev.
How are you?
I'm doing good. How are you?
I am doing well. Hey, take a minute, tell us about who you are as well as Arthur Marshall as well.
Sure. So, kind of a high-level introduction. Like Kevin says, I'm Justin Pointer. I run dental recruitment for the Arthur Marshall Group, which is a physician recruitment company that's been in business for the last 22, 23 years. Basically, we're in the business of securing key clinical employees for our practice owner clients. So that can be oral surgeons, specialists, dentists, down to hygienists, and even office staff.
And you just touched on it, but I know one question that I heard asked of you while we were at last year's annual meeting in Santa Fe was, what exactly does a recruitment firm do? And how do you all really make an impact with the clients?
Yeah, so for those that were there at the Santa Fe conference, you probably remember me and my partner, Kevin Simpson, looking like the FBI had raided the conference or something. So we're both kind of big, broad-shouldered guys. But essentially what we do, I would say that there's two types of scenarios that clients tend to come to us for. And that's to find a partner track type of candidate that would be able to act as a successor for a retiring practice owner, somebody that can be partner tracked or that's going to take an equity stake in the practice, or even just administrate the place, and then they can act as a remote owner, but allow them to kind of transition out. And the other scenario that we get asked about most frequently would be a more associate type candidate, maybe partnership at some point in the future, but somebody that can run a practice solo and be able to facilitate expansions, adding on a new location, or just increasing cash flow or being able to handle more volume.
And I know some clients have never worked with a recruitment firm, so they may not exactly know what it is or how to get started. So what are some questions that you think maybe people need to have in their mind before they even engage with you, or have in their mind whenever they first start talking to you all?
So that's a good point. Hiring a doctor nowadays it's not like going to the grocery store. Hiring a high level, dentist or a specialist is a very non-commoditized endeavor. You've got three basic options as a practice owner for how you go about trying to secure that type of hire. You start with your own network, people that that you might be able to hire. So teaching connections, the old colleague network, and you want to try and avail yourself of that before you take on the expense of hiring a recruiter. You've then, at least in the recruitment industry in our lexicon, you then have passive candidate sourcing options, which translates in real world English to a bunch of online do-it-yourself type of options. So job boards, CV services, things of that ilk. And typically you'll find that those are less expensive. You can kind of do them on your own and try to attempt to bootstrap it. If you've got to move outside of those spheres, though, you just don't have those kinds of connections, and you're not getting the types of candidates that you want off of Indeed or LinkedIn, then you have active recruitment. And essentially that could be a practice owner picking up a phone and blocking out some prospecting time, or hiring somebody to do it on staff. Or nowadays you've got third-party vendors that offer the same services a la carte. And that's where a recruitment company like an Arthur Marshall would be situated in that ranking. Now, the reason that we exist and the reason that practices and groups will turn to recruitment companies, you're just dealing with a very acute and basic supply and demand problem. Whether you're talking general dentistry or pedodontist or perio or endo or oral surgery, at the least you're dealing with a 3-to-1 deficit as far as how many groups are out there trying to hire these people versus how many actual candidates are available to be hired, and that's including new grads and current practitioners that might make a transition. It's real easy to get stuck, and one of the biggest points of frustration that practice owners get themselves into. I had a client of mine make this example for me. It's a little bit blue, but it's apt. It's like trying to find a long-term relationship, speed dating in a room with 100 guys and only 20 girls. And, of course, the guys are wanting long-term relationships and the girls are kind of more dating around because they know there's more of you than them. And that's kind of what these guys face. And unfortunately, practice owners sometimes get to a point where they feel like they have to take what they can get. No one ever comes to us just saying, find us a warm body. There is always some sort of ulterior business objective that they're trying to reach. And they need someone that's going to allow them to bridge that gap and reach the objective that they have. And that's why groups turn to recruitment companies.
One thing we've heard for so long, really since the start of COVID, is the hiring crisis. And as you said, the warm bodies that a lot of folks I've seen resort to, unfortunately, whenever it comes to team members. So why would you say that it's become so difficult to hire these top doctors and find the right people, not just a heartbeat to bring in?
Yeah, so COVID definitely made things worse. It turned a bad situation that's edging on a national crisis already, and just really brought it home in the short term, because not only were you dealing with a candidate environment that just doesn't have enough people in it for the number of dentists and specialists that are required to service our growing population, but you had people leaving practices. You had dental shutdowns, furloughs, layoffs. So you had pretty widespread loss of manpower, across the country, and not being able to really fill it. The biggest issue on a macro level is the baby boom generation is reaching retirement age, and unfortunately, that has a two-way effect. You have a loss of the doctors that are retiring, and you also have a larger than ever retirement population that's got Medicare and Medicaid, and everybody's insured now. So you've got more people using dentists and specialists than ever before, and practice owners are just stumped. It's not even just a question of I can't find any candidates. Anybody can hop on Indeed right now and go look at some CVs from dentists.
Sure.
We could hit our browser right now and be able to pull that up. The problem is that each CV you find, it's kind of like hunting on a reserve or something. I don't hunt, but it's like hunting on a reserve or something where every elk you find is already surrounded by 20 other hunters. There's just not enough to go around, and a recruitment company essentially gets you unstuck.
And that's a good thing, because I think so often we don't see how to get unstuck. And that's where we need to bring in an expert to help us with that, whatever that might be. One thing I heard asked of you all quite often during the annual meeting was not only about the recruitment of doctors, but also the recruitment of team members. And I know that you all, and correct me if I'm wrong, you all really focus more on the doctor side of things than the team member side. Is that correct?
Originally that was true. Not so much anymore, because we're just hearing the clamor from the market. The real issue, Kevin, was just cost benefit. In order to get people unstuck, let me first explain what that entails. Typically, what will happen is practice owners will say to themselves, I need to hire another key employee, whatever position that might be. And they attempt to reach out to their own network via word of mouth. They might try a couple of job boards, the ADA, the specialty associations, and a couple months down the road, just find that they're just not getting traction. They're no closer to making a hire than they were before they started. Just think of any dentist, even hygienist, specialists that most of them get their employment via word of mouth. Mm-hmm. Most of the time, It's just one colleague telling another about a cool opportunity, or a student gets picked up while they're in training. And that's how the majority of hires happen. Nowadays, recruitment companies are starting to take a bigger and bigger percentage of affecting these hires. But what the upshot is that if, as a practice owner, you go on one of these job boards trying to look around, the only people that are publicly broadcasting that I want a job are those grads that didn't get picked up while they were in training, people that just recently lost employment, foreign medical graduates, ex-military. Nothing wrong with those groups. I mean, a lot of times that's kind of the target you're looking for. More often, though, as I said, people are looking for someone that can handle a practice on their own as part of an expansion, or can act as a successor dentist in a retirement situation. And those are not typically, except for maybe ex-military, the groups that you're trying to go after. Recruitment firms, a full service recruitment firm, will not only go after people that are on these job boards, but will actively prospect and contact currently employed practitioners, finding those that are in a position to transition, and catching them at the right time. But it's a high manpower, high effort endeavor, and that's why people outsource it.
And one more question for you, and I want to make sure that people have your contact information. So we're going to give that right here after this question I throw at you, because I know a lot of folks wait until it's like desperation time almost to look for somebody.
Yeah.
How much planning ahead do people need to do in today's environment to have somebody in place when they actually need them?
Yeah, I would tell practice owners listening that if you are considering making a hire, and you've made any kind of attempt whatsoever, and just haven't been able to make headway, there's three questions that you need to ask yourself. The first relating to timeline, and that is, have you, as a group or as the sole practice owner, whichever it is, made the firm decision that you're trying to accomplish this hire in the next 6 to 12 months? If it's more of a, we want to put out some feelers, and if we get somebody in the next few years, you don't need to go with a recruitment company. But if you've made that firm decision, that's question number one. And then number two is, realistically, do you think you'll be able to affect this hire at the level of quality and autonomy that you need within a business useful timeline, using, your own iPhone and whatever numbers you've got in there, plus Indeed? Or do you think whatever shape it's going to take, do you need some help? And then last question is, if you've got to pay some kind of acquisition cost, is that worth it, in being able to secure the exact right provider that's going to let you fulfill the objective that you got? Our timelines differ depending on what we're looking for, to go one level deeper. If we're looking for any sort of specialist, surgeon, or dental specialist, you really need to have at least 6 months going through a recruitment company.
Mm-hmm.
I read an article in the New England Journal of Medicine that if you go at it on your own, you're looking at a 2 to 3 year timeline, still kind of having to take what you can get. Going through a recruitment company, we shorten that up. We represent the shortest, most high-powered method in the lexicon to be able to use. But even then, you need to have at least a kind of a 6 month window. For dentists, you can probably plan on 4 or 5. For anything underneath that, hygienist or office staff, 3 months.
Great stuff, Justin. And I want to make sure people know how to get a hold of you, as well as learn more about Arthur Marshall and get in touch if this matches their needs.
Yeah, absolutely. Best way to do that is to send me an email and connect for a quick phone call, basically to exchange information and see if we can help. And
can you give us the Arthur Marshall site as well, just in case anybody wants to do a little bit of research and connect that way?
Yeah. It's just www.arthurmarshall.com.
Sounds great. Justin, as always, thanks for the time, man. And thanks for
having me. It's fun.
Shed some light on things.
Absolutely.
All right, Fortune Management friends and family, thank you so much for joining us. We will be back soon with more information to help your practice succeed in 2022 and beyond.